Welcome into Eye.Talk.Tech, where we explore the intersection of eye care and technology. I am your host, Griffin Christenson. I am jacked up to be joined today here by TJ Wagner, founder and CEO of Wagner Diagnostics. TJ, you got a long bio here. You have a bachelor's degree in psychology, master's of industrial and organizational psychology, an MBA. You're a PhD student in organizational behavior. You do collaboration with the military, FAA, Department of Justice, and the whole works on your color vision front. I am excited to be joined here today for all of those reasons, but also I think you have a really compelling individual story to tell, and I kind of want to start there. First off, how are you doing today?
Thank you so much for having me today. I am so grateful for being here, being able to spread the awareness on color vision, and also just having a fun time with you and being challenged and all that jazz. So yeah, why are we here today? If that's something that interests you, would love to share. I came home at 6 years old with a note slapped on my chest from the school nurse saying, "Your son is colorblind." Please know, I do know the proper terminology is color vision deficient, but 99.9% of people out there say colorblind, right? So my dad being an optometrist was like, what? This is so embarrassing. I thought my son was just eclectic, which might still be the case. I don't know. I'll let y'all decide that. So he started really going, man, that's really embarrassing. So he went to a pediatric optometrist that he had taken me to and said, hey, did you test for color vision deficiencies or anything? And they're like, no, they're too young. They don't know their numbers yet for the Ishihara. It's too difficult. It's too long. And so he started really kind of diving deep into that. And he actually went and made the first pediatric color vision test called Color Vision Testing Made Easy. I think this was over 30 years ago, 1996. That's horrible. I can't think of it off the top of my head, but it was a long time ago. And it was interesting because, it was a passion project by a dad who was, inspired by his son who found something and he wanted to fix that. So he started creating that. And that worked out really in our favor, right? So that was pretty darn cool. And then what happened is, that was elementary school. I grew up and I was in grad school. IO psychology, as you mentioned, MBA, and I was like, I'm going to go to a Big Four consulting firm. It's going to be a blast. Can't wait for it. And who can't say no to consulting? And that was your family, your parents, whatever. And I said, "All right, Dad, tell me all about this color vision test." And he goes, "Well, I'll teach you all I know, but you want to go ahead and make this together." So we went ahead and collaborated and created the Wagner computerized color vision test together when I was in grad school. And that was a really, really incredible opportunity. First of all, just from a learning standpoint, because I didn't have a background in color vision at that point. But what was really cool is actually just building that relationship with my father, right? We've always been friends. He's always been a great dad, but he's your dad, right? And he was my dad, and we just became a lot closer. We talked a lot more, and that was a really awesome opportunity. So he started with color vision testing made easy. He then made books, and this was all validated by the militaries. They're accepted by the militaries and all that. And so now we worked on this together, which was really a really great project. And I thought I'd be in this industry for 3 years, 5 years. It's now been over 15 years of color vision for me personally. And the really cool thing about it, it's a niche. I think we can all agree with that, color vision. And then to take that niche even further is the fact that I do have a master's of IO psychology, which is job analyses, task analyses. Can people do their job properly, safely? So we've actually been hired and we work with lots of organizations to ensure that people can do their job safely, right? We provide our color vision test. We look at all their job tasks. We put those together and say, hey, if they're moderate or severe, they can do it properly. But if they're mild, they can do it properly. But if they're moderate or severe, they can't. And so we're helping these organizations create safer environments like law enforcement or pilots. So that's where we're at today. It's really exciting. We continue, the deeper I go into this rabbit hole of color vision, the less I feel I do know, to be fair. And so that's why I love, chatting with people like you, other optometrists, just to continually grow myself in this space. So that's a little bit about my background and how we started. And thank you for allowing me to share that. I appreciate it.
I think we have a lot of threads to tug on there, and I'm excited to explore that. I can certainly relate to the father-son nature of the journey here. My dad is an optometrist as well as TJ, And I wasn't colorblind, but I was left eye dominant. And I come from relatively rural Wisconsin, and deer hunting is a big activity here. We had toy guns and so forth. And my dad saw me wrapping my head trying to shoot a toy rifle right-handed, and wrapping my head around and trying to get my left eye through the peep sight there. And he didn't realize that either. So we went through the same thing where he kind of laughed and didn't realize I was left eye dominant until I went through hunter safety and the whole works there. But your dad was really inspired by the fact that this wasn't detected right away, or what really was the linchpin? Just the fact that you had color blindness, or why did he dive so hard into the deep end? Do you think on actually developing a test to help others?
Yeah, I think the fact that pediatric optometrists at the time were not testing, and the children, and at the end of the day, that's such an important aspect of kindergarten, right, and first grade, is we're learning our colors, right? And I'm not sure how familiar the world is with self-fulfilling prophecy, but oftentimes what happens is when somebody is given let's say that, I'll give you a great example. There's two teachers, right? One teacher is told that their students just did incredible on this test, and they are required to now improve their scores, okay? Well, they played a little trick on this teacher. It actually was the students that had the worst scores, right? And then they did vice versa with another teacher. They said they scored the worst on this test. We really need to help them. But they actually did the best. So what happened was, after they did this, they went and took that test again, a post-test on the same test. And what it showed was, when a teacher was told that the students did worse and it was, they had to get them better, they actually treated them in a different way than those that were told they did best. And that score significantly was better for those that were told that they did better, even though they did worse, right? So it's a
Sure.
self-fulfilling prophecy. So basically a teacher goes, oh, they don't know their colors, they probably don't know their numbers, and it really can lead into a snowball effect, right? So I think my dad saw a lot of that happening, and he was like, well, they really should be testing right now. So that's where it started, and that's why he got passionate about it. And I think just like you, right? You just mentioned that. I think Optos was another organization that was started because of father and son. That happens a lot in these medical device industries, is because it's a passion project. And so I think that's exactly what it was. And so he went on to do that, and then became a color vision expert for the US militaries, and started looking at those tests and helping make those tests better. And that's where we are today.
Well, and that's a really cool origin story, certainly. But you've kind of, continued to work on this, of course, and now we're taking it into a digital age. And in fact, that was even a while ago. We might have to look at what maybe the next phase is for you guys too here at some point. But in that transition period, going from an analog to a digital test, I'm kind of curious, what was one, the impetus for doing that, and what have you guys learned along the way after making this, a digital product, or rather than the booklet that we might have been familiar with?
Yeah, so like every graduate student that knows everything, and that was me. I realize now I don't know everything, so that's, I guess, called maturing. I said, "Oh, I could do better. Why don't we make this digital, Dad?" And that's exactly what we did, right? I wanted to automate it because I did understand the scientific method, and I believe that everything should be standardized in when we're doing science and experiments, when we're providing care to patients. And that book, we were noticing, what do you see? Or, hey, do you see a 45? Do you see a 17? Do you see a 12? And it just wasn't being done properly. So we created self-scoring, removed administrator bias, and we just started working on this. And then another really, really, really important aspect, which is an interesting fact, is the fact that Ishihara was never even testing for the blue deficiency or the Tritan deficiency, right? It was just looking for red and green, which is usually and most likely genetic, right? And this Tritan deficiency, which again, 8% of men have a red-green color vision deficiency, right? 0.5% of women have a genetic red-green deficiency. However, 15%, 15% of the general population actually has an acquired color vision deficiency. First of all, top 4 leading causes of blindness, right? This is actually why I get so passionate about it, because I do get excited about helping the children and helping them be more successful. But now this preventative care, right, is so important to me. And the fact that the top 4 leading causes of blindness all cause an acquired color vision deficiency is fascinating to me. And I tell you, the deeper I dive into this, the less I feel I know. So the reason I say that is I didn't learn about that Tritan defect until probably 8 to 9 years ago, and I've been in it 15 years, right? But we created that Tritan test for just because we knew we could. And then we started learning about the acquired aspect later on. So that has been a huge benefit. I mean, nothing makes my day more than hearing from a doctor, we love your test, and the reason is because we literally have found people that had glaucoma, macular degeneration, great, and that they didn't know they had it beforehand. And you're the optometrist, you know this better than I do, but if you can get ahead of things, then it allows them to see longer, right? It allows them to have that sight. They're productive citizens of society. They're happier. There's so many things about vision that is tied to mental health also, and that when the people get glaucoma or they go blind, it does have an effect on mental health. We know that. Lancet Publishing says it. So that's one of the things that gets me really excited about this, and why I do try to push it so hard and educate doctors on it.
Sure. Well, and we know there's some and the research is continually emerging evidence that points to how early we can detect some of these various leading causes of blindness that you point out. But in addition to that, it looks like there's some evidence that is pointing towards not only detection but also monitoring progression. Is that something that you guys have been following closely?
Absolutely. Actually, that's what we really want to see doctors doing, right, with our test, is not just red flagging and then helping identify the disease, but then, sending a color vision test to the patient's home. And that way they can measure the progression of the disease. Hey, you need to come back into the office. We saw there's a decrease in your color vision, specifically Tritan. We need to see, is your medication on point? Is it this? Whatever the case may be. And we truly do believe that improves patient outcomes. And I've gone through a lot in my life from a health perspective, had some health obstacles, one primarily being end-stage renal failure. So to know that I have a true passion and calling to improving patient outcomes, very affordably and making it as accessible as possible.
Sure. And so a disease, like diabetes or something like that, we've seen going from finger pricking to continuous glucose monitors and so forth. And, for color vision, maybe going from clinical testing to at-home monitoring. Is this something people can do on their device? Are you guys doing that currently, or is that coming down the pipe?
Yeah, so we do have an online version right now. However, we are, for the clients, so the one that sits on the computer, we are actually creating that functionality right now. So that way the doctor can have all the patient information, they can set it up. It's going to come out very soon, and they click, hey, we want to test them every month. We want to test every 3 months, and send an email to them. They click on it, it allows them to take a test, and it sends that data right back to you. So you're spot on with diabetes and diabetic retinopathy, which also, that brings me to another fun fact, in my opinion, that I've just really started to learn, right? There's three theories on color vision. You've got the color opponent theory, you have the trichromatic theory, and then you have zone theory. And basically the color opponent theory and the trichromatic were on their own. And zone theory brings them together because they were both actually supported through peer-reviewed science. And so what we're seeing with diabetes is, I believe that with diabetes, before there's actually any retinopathy, which would be affecting our cones, it's affecting our retinal ganglion cells, right? So we are finding that. And that's a really early sign, right? Saying, hey, there's something wrong. And then it allows you to go dig deeper. We found it with MS, without optic neuropathy. It's actually an article we are working on that's been submitted for peer review. And so that does get me really excited. And again, the deeper I go into that rabbit hole, the less I feel I know, because I always was like, oh, the cones, they're getting destroyed. That's why that Tritan is coming first. Well, now we're starting to see it in the retinal ganglion cells, not just in the cones, which again, that was recent, right? And so I just keep learning more and more, which is really cool.
Sure. And at a foundational level, like you mentioned, having the blue aspect, the Tritan defect, being something that we can detect, certainly an important thing in detecting various diseases and acquired loss and so forth, but also just having a standardization. Could you talk a little bit about, I remember learning in school, so you might have to refresh me a little bit here, but hearing about the number of foot candles of light and ambient light that's supposed to be in the room when you're color vision testing. And is that something that you can just standardize with the digital version of the test, or how
Yeah.
does that work?
So that's fantastic. I tell you, Eye.Talk.Tech is a great name for this, especially that question aligns so perfectly with it. So when it comes to that, so standardization of any test. So the good news is I know every single doctor out there uses a 6,500 Kelvin light when they use their book tests. That's
Exactly
me being
right. Yeah.
extremely, being extremely sarcastic. So truly, the only valid test for a color vision test is given under a 6,500 Kelvin light. Also, those books do need to be replaced, right? I don't have peer-reviewed that evidence on when it needs to be replaced, but also just usage, right? Those fingers, the oils, this light, all that can have effect on the colors in the book, right? So what's happening is if you're not using a 6,500 Kelvin light, if you're not doing this, then you're actually not giving a valid color vision test, technically. So what we have done is we are starting to look at, yeah, you're exactly right. When it comes from the monitor, it actually does not matter about that lighting in the back because the light, is produced by the actual monitor itself. It's backlit, right? And so we are able to go ahead and if you use a test that says, hey, make sure you go and remove your blue filters, make sure you remove HDR, we make sure, and you remove all this stuff, and then we also put that lumen and hold it constant during the test. So great question. I love it.
I couldn't remember if we were talking color temperature in Kelvin or foot candle. So thank you for illuminating that for me. The other thing that you mentioned, certainly your dad was a man of many professions. I know you can maybe talk a little bit about that, but the impact that color vision has on some of the professions that he actually held, I think, is an interesting one. And what's been, the development that you've seen in the acceptance of color vision testing being an important feature for screening who may or may not be a good fit for a particular position.
Yeah, so that's actually my dad is one of those individuals where you keep talking to him and he's an onion that just continues to unwrap and you just learn so much. So, he was a park ranger. He, was a Huey helicopter pilot during Vietnam, flew over 950 rescue missions. Then they were like, do you want to stay here? Do you want to go to optometry school? He picked optometry school. And then I think, yeah, we have talked about he was also a police officer. He would go to work as an optometrist. I believe it was Newport Beach. I know it was Orange County, California. And then after getting done with that, apparently he needed an adrenaline kick. So he would start going and become a police officer after his day job and then do it again. So we have really started to notice that is one of our specialties, as I mentioned earlier, is occupational health testing from a color vision perspective, right? Our goal is actually to expand the amount of people that can go perform that job, right? We do not want to take it away. I'm a severe deutan or a severely green weak individual. Obviously, I would like the option to go and do all these jobs. I will say when it comes to being a pilot, I can't do it. I would never recommend getting in a plane with me, personally. But even police officers, we have evidence through our research that we've done through a grant with the Department of Justice that we now know that people with a mild color vision deficiency technically cannot do their job properly as a law enforcement officer. Right? We were a little shocked by that. We were expecting moderates and severes not to be able to do it. But somebody with a mild deficiency, they have trouble with lights. And when I say lights, I'm literally talking about the traffic light. Red, green, and yellow. And people are like, oh, yeah, it makes sense. Red, green, color vision deficient. That's why you have a problem, the red and the green. It's actually the red and the yellow that we have a lot of problems with. And actually, that leads me to an entertaining story. When I was 20 years old, I was driving in the car with a friend, and we had 3 friends in the back. We're driving, to whatever social gathering it was in college, and he starts slowing down at this intersection where there's a police station on the corner and a blinking light, right? And he starts slowing down and he goes, hey, what color is that? What color is that? I just looked and I said, I don't know, I'm colorblind. And he goes, me too.
Oh,
So
man.
we literally came to a complete stop at a blinking yellow light at the corner of a police station. And everybody in the back was like, why did you stop at that yellow light? Because nobody yields at a yellow light. They just go, right? And so that's, hey, I should have, at that point in time, could have gone to all those police and all those commercial drivers and things like that and told them, but that's not, I was not thinking about becoming a color vision expert at that time. I was 20 in college and studying psych. So, Yeah, my dad did that, and now we just try to look at occupations and try to help them as much as possible.
Sure. And where do you maybe see an opportunity, within the optometric field to be a part of that discussion, or how do you see that relationship working at its best, in your experience?
Yeah, that's actually a great question because that is one thing we're trying to educate optometrists on right now is, hey, it's first of all, it's not just about the genetic. Call your local police stations, call your local sheriffs, they all need these color vision tests, right? And I know a lot of them that provide this, which is awesome, or call your local FAA aviation medical examiner and ask them, do you have the Wagner computerized color vision test or one of the other two accepted by the FAA? If they say no, say, hey, we'd be happy to see these pilots, applicants, to see if they can pass the Wagner CCVT. This is a great opportunity. It's not about reimbursement, right? It's a cash pay, which is fantastic for the office. And also, you got to think it's a pilot, right? If a pilot is coming in, one, it's either a recreational license, which means they probably have some disposable income to pay a $50 color vision test fee, or they're being sent by their employer, right, which is going to be reimbursed. So it's a great opportunity, in my opinion, for optometry to really look at occupational health color vision testing and contacting those organizations to see what they can do. That was a great question. Thank you so much. That's
Yeah.
something we've been really trying to educate optometrists on because we're trying to help them grow their businesses also. So that was a great one. Thank you.
Yeah, the other thing I'd be really, curious to get your perspective on, and I'm probably guilty of this myself, is, we see someone in the clinic who might have a color vision deficiency. It's kind of like, oh yeah, that is what it is. There isn't a lot we can do there, and not that we would be dismissive, but there just isn't a lot to talk about there. I think the point you brought up earlier about how information is presented to people, particularly the classroom, and how we're going to improve success rates there. How might you present that information as someone who has dealt with this a lot, but also is color vision deficient yourself? And do you have any thoughts on that?
So what do you want to tell? Yeah. So it really depends on what age that patient is. And you are right. I don't believe optometrists are dismissive of it. They're just like, well, there's no way to correct it, right? It's not like a visual acuity problem that you can go ahead and provide glasses for them to help see the board. It really comes down to, so if they're young and in elementary school, please do the test and then tell their parents, and then tell their parents to go tell their teachers, right? So they don't fall into that self-fulfilling prophecy. Also, start to manage the child's expectations. Maybe they won't be a pilot when they grow up and for the U.S. military or FAA or anything like that. So it's something just to manage their expectations, because it's actually, fun fact, 20 to 30% of people who are color vision deficient don't even know they have a color vision deficiency, right? So what happens often is somebody who has never tested or they didn't know, they go enter the military, they enter a profession, they get that test and like, no, I'm not colorblind, color vision deficient. And like, oh, you are, right? And that really does, and I see it. I see them get so bummed about it, and that bums me out to see people get bummed that they can't do a job. But that's what makes the world go around. It's not a deficiency, in my opinion, and I hate saying deficiency. We see the world differently. We can see snipers easier. We can see deer if you're out hunting easier. Why? Because we're not using color, we're using pattern recognition, and we can see that they're out of place, right?
Mm.
So it's things like that that have been really interesting, but just trying to say, hey, you see the world differently, especially to these 6, 7, 8-year-olds who are being tested. Like, not a problem. You're just seeing it differently, and so you keep living that best life.
Well, I think that's a great thing to share, is that fact that you just said about, maybe you'll see deer in the woods a little bit easier. That'd be a popular one for me with my patients in Wisconsin for sure.
Out here
Um,
in Arkansas, it's popular as well.
there we go. The other one that I'd be curious your perspective on is maybe interventions for color vision difficulties. I know you might have an opinion on enchroma lenses. There's also genetic research being done, right? That maybe there's a cure for this. Like you said, you see the world differently. Would you even want a cure personally, or do you like the way it's situated? And is that something that you follow the research on that front?
Yeah, so happy to. So, when it comes to these filtered lenses like in chroma, I think it's really important to point out this does not allow people to see normal color vision. As a matter of fact, it's a filter. So it's actually filtering out even more colors that are getting into your cones, right? It's actually rejecting them. But what it's doing is it's separating, and so something else, and it's easier to differentiate, okay? That is why people go, oh my, and I also will say, when I see the people crying, I have never put on a pair of lenses and started crying myself thinking I saw. Like, it's just, I'm sorry, no, I'm very, very sorry. Now, here's the thing though. I do truly believe, like as somebody in psychology that does research, if I was in a clinical a trial and they're like, okay, if we take this little pill, it could, I mean, it's going to increase your productivity by 500% every day. But, you know, some get a placebo sugar pill and others get the actual. After 2 months, if my productivity has gone up, I almost want to like, don't tell me what you're giving me. Just please continue giving it to me. Let me be productive. And I kind of put that analogy onto those lenses. Go and try the lenses. If you truly feel it improves the quality of your life, excellent. But don't expect it to, because the science shows that it doesn't do that, right? So that's, I actually, you know, I always just say to people and doctors, well, should I sell them? I say, well, ask the patient to put it on. If they go, wow, this really does improve the quality, then do it. I would do the same with a sugar pill and the other thing, like in a clinical trial for that kind of productivity. So I hope that answers your question in regards to lenses. And then, sorry, can you remind me what the other?
Yeah. No, I
Oh,
was just curious if the
a
genetic.
cure.
Oh, what's
Yeah,
that?
the cure that we were talking.
Yeah,
You brought
exactly
up,
right.
and that's at, I believe, the University of Washington, Dr. Jay Neitz, Neitz, I believe. And I'm so sorry if he's watching this and I'm mispronouncing his last name. I've only read it in a lot of peer-reviewed articles. He's a brilliant man. And yeah, what he did is he went ahead and took some cones and injected it into a rhesus monkey, a monkey, I can't remember what kind, and it did allow them to get normal color vision, right? Now, I don't know when that's going to come out. This was many, many, many years ago. You know, I think a lot of scientists are working on a lot of things, cancers, organ transplantation, things like that. So who knows where that will go? I know it will eventually happen, but as of right now, it is not used. Well, nobody's had it done themselves, right? It's only been done in
Sure.
monkeys.
Sure. Well, and with all the careers your dad had, maybe a future pilot career isn't out of the range of possibilities there for you still, TJ.
Thanks, Griff. I might be a pilot, but only a daytime pilot.
There you go. There you go. Well, TJ, is there anywhere that our listeners could go to learn more about the work you're doing, to learn more about the Wagner color vision test, or to just find what you guys are working on?
Yeah, absolutely. Always check out our website, www.wagnerdiagnostics.com. One thing that I think is really important, since this is mainly for optometrists, is hey, there's an incredible CPT code associated with this. I believe to $55 national average. CPT 92283. And you can get reimbursed for 3 different reasons. Sign, symptom, family. Sign. Guess what? You take our test, you fail the first screening sections, it takes you into the extended version. That's the sign. You failed a part, we give you the extended. That is a reimbursable test. Symptom, you have high IOP, or the patient has high IOP. Maybe there is a visual field defect, which, by the way, color often appears before. An acquired defect appears before a visual field defect. Again, anything I say like that, going to be peer reviewed. Want to make sure that is out there. And anything that's in my opinion, I'll say that too. So I think it's a really great opportunity to not only improve in patient outcomes, but really improve the revenue of the practice. So you can grow and hopefully provide better care to even more people. Grow your practice, buy another practice, build another practice. So our goal is to help on both those fronts. Provide better patient care and help your business be more successful monetarily.
Awesome. Well, TJ, thank you so much. Pleasure chatting with you. And that is another one in the books for Eye.Talk.Tech. Thank you guys.
Thank you so much. Have a good one.